It's a 60-bed rehabilitation and evaluation unit, and we're the largest regional rehabilitation unit in Victoria, and we service an area, or Loddon Mallee Campaspe area. And we also have southern New South Wales and a lot of referrals from Melbourne hospitals. So we're a fairly busy unit, so we've got a lot of staff, a lot of patients, and that sort of means a lot of medications and a lot of medication rounds. We'd had a bit of an increase in medication errors, and we thought, what can we do to change that, or why was it happening? Why was we getting this increase, and what was happening in the unit? So we did a survey of the staff. A lot of staff admitted that they were interrupted, for everything from continually to sometimes, but they really didn't feel that had any impact on their medication errors or how they were going. So then we did a bit of a lit review, and we actually discovered that there had been some research with interruptions and medication errors, and it was actually quite a high correlation. So we looked at that and how we could manage not having any interruptions on the unit. For a start, we put signs on the medication trolleys, which most people took a bit tongue-in-cheek. I mean, nurses feel that if a patient asks them to do something, they feel that they really should do it, or if people ask them about things, that they really should answer their queries and not just fob them off with, I'm doing medications. And we thought, well, they're not taking this medication bit really serious as we should. Yeah, our trolleys we take from room to room, so we might have one nurse handing out up to 15 patients' medications. And there's a lot of medications in there. Trolleys didn't seem to make that much difference. They may have. So then we discovered the vests. Medications do not disturb vests. And not only did it sort of point out to me included not to interrupt them, because you can see it coming down the passage who's actually doing it, but we were surprised, well, not quite surprised, that patients too started saying, oh, you're doing the tablets at the moment, I'll wait. And it empowered the nursing staff then to say, look, I'm sorry, I can't do it right now. I'll come back after I finish the medication. So it gave them the empowerment, I think, to just not feel guilty if they don't drop everything there and then and do something. Actually, we were sort of surprised, really, when we did see the results. And the satisfaction, it shows there that there was quite a peak with medications before we introduced it. And afterwards, it just was a decline down. Amazing how we thought it might have been a people issue, and it was actually a situational issue that changed it. And staff have now accepted it fairly well and wear the vests without much prompting, and are fine, fairly happy to concentrate on what they're doing and not be interrupted. We have enrolled nurses and Division 1 students, so we've always got lots of people that we're helping with medications. And by having that vest too, I think, indicates to them the importance. So they're learning that the medications aren't just something we hand out, it's something we really have to concentrate on and make sure that we're doing it right. The incidents that occur all go into our incident database. So we get feedback every month of how we're going with the incidents. Anyone that does happen to make a mistake, I follow up with, and we talk about what went wrong, why that mistake happened. With the staff, we haven't found many now that are administration errors. There's often other things that can go wrong. And with the ongoing education, we just follow up with any new students and staff coming to the ward. But we've persisted and gone on with it because we did have such good results with that, and it has made such a change. We haven't had formal education, but we do follow up with all the staff that come. So we've shown that we can actually reduce those errors, and it's got to make it better for the patients.